Good afternoon, everyone. I want to talk about a topic that I find very important in today's society. Childhood ADHD has been around for a very long time. The problem with that is that it's not going away. The rate of children being diagnosed with ADHD is rapidly growing. Many providers, teachers, and parents feel that medication is the key to help these children with ADHD. However, I want to tell you there are some very risky side effects to these medications, but there is a safer alternative way to deal with ADHD. The number of children that have been diagnosed with ADHD and taking medication has grown rapidly over the last decade. In this quote, it gives the evidence that tells you how across the U.S. in the 1990s, there were not many children that had ADHD, but since the year 2000, it has rose. This information proves that there has been a rise in the number of children that have been diagnosed with ADHD, which is also because of being overly diagnosed. As you will see in the following chart, you will see how ADHD diagnosis has risen since 1980 to 1995. Then if you look at this chart, you will notice how much it has risen since then. Take a look at this quote. Even with all the information, there is still a debate with the fact that ADHD is overdiagnosed. Some physicians and healthcare workers claim that ADHD is underdiagnosed. According to this information, ADHD might be on the rise for children, but for adults it is underdiagnosed and undertreated. So this should tell you that it is not overly diagnosed, but not diagnosed enough in adults. Some teachers believe the only way to deal with a child with ADHD is medication. In the following quote, you will notice that there are a lot of teachers that feel children that have ADHD should be on medication. With this quote, you may be asking yourself, why am I giving you all these percentages? But if you look at these percentages and get a good look through my eyes, you would see that teachers are all for medication for ADHD children. What I hope is that this persuades you to stop and think about how this view may not be the best choice for a child's health. You will notice that according to this quote, some teachers have different acceptability for each boys and girls when it comes to medication. In this quote, it is trying to give you the assumption that teachers only feel medication is okay for boys. This informs you on the view of some teachers that believe that ADHD medication should be given. It gets you thinking about if these teachers really knew about all the harmful side effects, would they really refer these children to physicians to be put on medication? ADHD stimulant medication can potentially hurt a child with all the risky side effects. Take a look at the quote. You will notice side effects that can happen as a result of using ADHD stimulant medication. Are you willing to put a child through that? Some more of those risks that are associated with children and adolescents that are on stimulant medication are dizziness, headache, heart palpitations, loss of appetite, anorexia, nausea, vomiting, constipation, stomach pain, blurred vision, liver atrophy, tremors, hair loss, weakened immune system, hormonal disruption, hepatic coma, angina, and toxopsychosis. With this information, it shows you the risks that are involved with stimulant medication. Think about it. What if this was your child? Would you put your child through all that? As you will see in this chart, look at all these risky side effects that can potentially harm a child. On this chart, you will see all the stimulant medications that are prescribed to young children. And on this chart, take notice how ADHD stimulant medication changes blood pressure, also how it changes the heart rate. With this in mind, let's move into what some medical personnel want you to think about these medications. As you will notice with these quotes, that physicians and other healthcare workers claim that the cardiovascular risk is low. They also say that children should continue with the medication so they can benefit from it. However, you have seen the facts about how ADHD medications can cause heart problems and other risky side effects. Would you be willing to put your children through this? What I would like you all to consider is a safe way to deal with childhood ADHD. Take a look at this quote about alternative medication and think, would it be better to let my child live a normal life other than being like a robot? There are many different safe alternative ways, but one I have found is exercise. It can help a child with ADHD because it helps direct their attention and help them focus. A few others are the following: neurofeedback, physical exercise, restricted elimination diet. As I hope you can see from this information, there are alternatives out there that can help with ADHD, that can potentially improve the symptoms of ADHD. Some medical personnel feel that alternative treatments are risky and shouldn't be used unless they are being used with stimulant medication, according to this quote. According to this quote, there is not enough evidence to support alternative medications, so you would be taking risks even doing alternative medication. Even with all this information, you need to understand the benefits of alternative treatments. Alternative treatment options are out there that are safe. To end, I would like to tell you there is much evidence to show that physical exercise enhances brain activity and modulates neurotransmitter systems, thereby improving memory, concentration, learning, and mood. As I hope you can see from this information, there are alternatives out there that can help with ADHD, that can potentially improve the symptoms of ADHD. With all the information provided, why would you put a child at risk by giving them stimulant medication that could potentially harm them? So again, think about it. If it was your child, would you put your child through all that? I hope this gives you a little insight about ADHD medications and about the benefits of ADHD medications. We as parents, teachers, and healthcare workers need to think of not only what would be the best for the child, but also their health and safety. Say no to stimulant medication. Say yes to a safe alternative treatment. Thank you. Have a good day.